This is so cool. I think I finally got it. Hi, Melissa. Hey, everybody. Hi, Cynthia. And there's Sandy. I actually think I am streaming on Instagram. What's it been, like 3 months? And I finally figured out how to do it there. So that is awesome. I have this thing called StreamYard, and it streams to Instagram, Facebook, and then I have to do TikTok separately. So I'm sorry on my Instagram. I might not always see you guys over there, but I'll try to pay attention to both. Melissa says, do you only do hormone therapy for older women, or do you see younger trying to get pregnant? Absolutely, absolutely. I have a whole fertility program. I haven't quite got it launched. I do it in my office, but if you want to go to my link in bio, you can find our contact information. And pretty much fertility is so easy to treat because it is the basic premise of treating estrogen dominance, and our hormone program absolutely can help you as well. So if you go to hormonebliss.com, we start with ordering a test kit and we can get you balanced. I don't know if you can see that on the channel there. Do you have a YouTube channel? Board is backwards. Oh, I thought I fixed it. Oh my gosh, I'm all sorts. Yes, I do have a YouTube channel. It's Dr. Tammy Tucker. There it is. Yay. I thought I fixed that when I did that. Hi, Winona, Michelle, Carol's here. Yay, Lisa's here. Awesome. So, yeah, oh, someone older. Yeah, so we do all ages, and it really just starts with a hormone kit. And so this is cool because I'm going to talk about all things hormone testing tonight, which is really awesome. Yay, Winona, I'm so glad. So I was doing every night at 7 o'clock for like the last 2.5 months. And then I just decided it was just kind of tricky. Yeah, you got your pink hormone box. I love it, Carol. Um, but it was just getting kind of tricky because every night I cannot go to dinner or do anything. I love you guys so much. And actually, this past weekend when I wasn't there, I was like, it was really hard for me because I missed you so much. I like almost just got on, and I thought, you know what? I'm just gonna take a little break. So it's okay, take a little break every once in a while. But yeah. So Monday, Wednesdays, and Fridays is my new time. And those of you that are in our membership, we are scheduling, I think it's the first week in February. So coming up. And so I'm going to get to see all of you on the Zoom live. So I'm super excited about that because I can't see your faces right now. I just see your name. So super, super exciting. I'm going to adjust this a little bit. There we go. I can see my board. Hello. And I know on Instagram world, it's a little trickier to see that. So hopefully anybody in Instagram, if you ever want to go over to TikTok and find me, Dr. Tammy Tucker, it's a little bit easier over there, I think, because it looks like a little lag time there. Okay, so yeah, little housekeeping. If you like the content, if you press the screen with your finger, it sends up little hearts, like the little hearts that are going up right now, and it lets people know that we're talking about cool stuff. And if you go to my link in bio, all my information is there, and you can find me. And there's lots of free downloads for books and all sorts of things there. So information, I'm all about information. And our website is Hormone Bliss because it's all about bliss. And I think that's it. Yeah, and there's also a little share button. So if you want to share with a friend, you can absolutely share. Okay, so what are we talking about? So when I created this whole passion project to be able to get women the help that they need, I was like, what's the easiest way to do that? And how can we get it to the most women? Because you guys have probably heard me before say, before I leave this planet, I want at least 50% of women to have the option or at least have the conversation to be on bioidentical hormones. And there was a study done in 2002. And before 2002, almost 60 to 70% of women over the age of 50 were on some sort of HRT. After that study, less than 1 year later, it went down to less than half. So we went from like 70% down to 30%. And now, 20 years later, 2025, less than 1% is estimated are on hormone therapy. Now, I always say that might not be exactly accurate because there's not a whole lot of tracking that happens with compounding pharmacies because the electronic medical records track prescriptions. So if you're on an estrogen patch or progesterone pills, it does track that, but sometimes the compounding pharmacies don't report in the same way, and because it's not um, commercialized, right? It's not in a big system like that. So anyway, it's still not very many. And case in point, if you ask any of your friends, are you on hormone therapy after menopause? They're like, no. But if you ask any of your friends younger than menopause, are you on birth control? And they'll probably say yes. So it's like, it's okay to be on synthetic hormones, but it's not after menopause. Approximate cost per month. I need BHRT. It's the test kit is only $129 and it's on sale for $109 right now. But after that, when you get into the membership, it's different whether you want to go month to month. And then if you want to pay in full, you get a bit of a discount. So yeah, so under $200. So, and I know sometimes people think, well, insurance doesn't pay for that. So we do HSA and FSA. So if that's something that helps, but if it's something that changes your life, what's that worth? And I hate it because some people spend $200 a month or more. I even have people have told me they spend like $1,500 a month for their family for insurance and they get absolutely nothing. And, there are people buying those weight loss shots that are like thousands of dollars a month. So I'm like, I don't think that that's that much of an investment to feel better. Oh yeah, Melissa. Yes, yes, yes. Come see. I'm trying to kind of look at my Instagram too as I'm on here. This is exciting. Okay, so yeah, so I'm going to jump into this because I think this is fascinating. A lot of people have asked me over the years about saliva testing. Is it accurate? Do I, you know, do I need to do that? Do I need to do blood tests? Sherry said, been on it for a week and feel a big difference. Way, yay, Sherry! I'm so glad. Thank you. And Sherry, I was so excited when you asked me about your friend a while ago too. So I'm like, yes, yes, yes. So I'll send you more information on that too if you need something. Okay. So when I first started doing bioidentical hormones years and years ago, saliva testing, when I wrote my first book. So this is, hi Connie, this is my second edition. But when I did my first book, I was really learning all of the John Lee stuff. Thank you, honey. I was learning all of the founding father of bioidentical hormones, basically Dr. John Lee. And he really was a big proponent of the saliva testing. And I'm going to explain why in just a minute. So, sort of the way I learned was through the person who really started moving away from synthetics and was actually talking about the different properties, the different routes of delivery. And so, if you ever want some extra fun reading material, there is a great series of books that Dr. John Lee wrote, and they're called What Your Doctor May Not Tell You About. Fill in the blank. So, what your doctor may not tell you about menopause, what your doctor may not tell you about estrogen dominance, what your doctor may have not have told you about breast cancer. And actually, the one about breast cancer is one of the most fascinating ones. And it was really that pivotal point when I said, this is nuts. This is crazy. Why don't doctors know this? And I don't know if you've heard the story, but basically, it was right out of my residency, which was almost 25 years ago. I had a lady that came to my office, brand new doctor, right in clinic, and she said, can you write bioidentical hormones for me? And I was like, what? I mean, I'm a medical doctor. They didn't teach us any of this in med school. I'm like, this is like, what? Like, it was crazy. And so I looked at it and it was like E1, or was it E2, E3, P, it had PREG and it had TEST. And I'm like, what the heck is this? And so she actually had the bottle with her. She had like a copy of the prescription that her doctor had sent with her so she could find someone in Arkansas. And she thought, I guess I was open-minded enough from what her friends had told her that I would do it. And so I said, okay. I don't see why not. And then I was like, okay, I'm going to study this. And we actually had to find her a local compounding pharmacy. And so a compounding pharmacy is just someone who individualizes and mix stuff, not just a pill counter like commercial pharmacies. And so I started reading about it. And the first thing I found was Dr. John Lee's book. And it just blew me away because he was talking about the topical route, bypassing the liver, doesn't stimulate the clotting cascade, that it has all these protective benefits for your bones and your heart and your brain, your skin, your bladder. And I was like, I was still stuck in that box where, that thinking is that hormones cause cancer. All from that stupid study in 2002. I shouldn't say stupid because there was actually some good information that we got out of it, but there were several things to that. And one of those things was that synthetic hormones caused problems. And that's completely different than what we do. So when I preach that hormones are safe, bioidentical, meaning the same structure as our body, are safe because they're not synthetic, made from petrochemicals, breakdown products with patents that look like hormones, but they're petrochemicals. I'm talking about the safe bioidentical form that is the same form organically as our bodies make. And then I'm also talking about the the route of delivery. So topical is the way to go, right? So that is what makes me say hormones are safe. So you can put me in that box saying hormones are safe, just like everybody, the commercial world says hormones are dangerous. I'm completely safe. So there's hardly any scenario that I would ever say that you can't take bioidentical topical hormones. Now, nothing is without risk, and the risk is that you can get an imbalance that can trigger some side effects. And so we don't want that. And that's why we test. We test because we want to get it right. And even when we test, we don't always get it right because everybody is different, everybody processes different, and everybody's levels are different. And so we are going to go through some labs tonight, and we're actually going to look at some patients. They're blacked out, so you can't see them, but it's hard to see anyway because it's tiny print. We're going to go through 3 different patients if we have time tonight, at least one, but I'm definitely going to talk about the different testing and how it works, and the different methodologies and how it works. And then we're going to go through a couple of case patients. How's that sound? Is that cool? Okay. So let me show you what this is first. So this is our test kit. So when you order this, and if you want to order it, hi Paul, if you want to order it, you just go to hormonebliss.com. And also my link in bio, if you go to my main page, if you click on my picture up there and it takes you to my main page, you can order the test kit there if you want to. Okay. And so what happens is there is what's called a test requisition. And so you put in your name, your address, male, female, birthday, height, weight, and then you put in the last time you had a period. So if you're postmenopausal, that might have been years ago. Whether you've had a hysterectomy or ovaries removed, and all this information. And why am I saying that? Oh, thank you, Connie. Why am I saying that? Because this information is very important because what this lab does is more than just give you a result. This lab actually interprets everything, so it makes my job really easy, which is why we can do this on such vast scale because they do all the heavy lifting for me. Now, it is my protocols that we actually dose our members with when we're getting them on creams. And so that is taking that information and the way the milligrams in cream and grams and how we dose per person. So that's the beauty of working with a team like ours because we can work with you and tell you how to adjust things. And side effects are not really risks. Side effects are when you get a little bit of breast tenderness, or it's very uncommon to have uterine bleeding if you have a uterus, but that could happen. I mean, it's rare, but it can happen. Or, sometimes you might get a little too much testosterone or something, and then you might feel a little grumpy, too grumpy, or you might have a little acne or something like that. So we're trying to regulate everything. And there's absolutely a change in thinking when you're thinking about preventing heart disease, preventing cancer, preventing wrinkles, preventing all the issues that can come up, and how to actually use the minimum dose, which is what a lot of doctors in the commercial world with this whole fear thing of hormones, they're like, oh, we're just give you the very lowest dose possible because it's dangerous. So you can only have a little bit. And that's like saying you have shoes, you don't have, like, I get all flustered when I think about it, but it's like saying, if you didn't have a thyroid, oh, we're just going to give you the littlest bit amount of thyroid because hormones are dangerous. So it's just, yeah, it's crazy. The thinking is just, it's not for optimization. It is really just for their fear, and you can have a little bit if you absolutely have to. And that is really, from the videos I've done, you can see that that thinking is just super outdated and it's not relevant to the science. Connie, do you have different formulas or just the one? So we usually, once we dose everything, we try to do a combo cream that has everything in it just for the convenience. But sometimes we have to do separate. So we usually have a combo cream that has DHEA in it. And then sometimes we do separate testosterone if the levels are low enough. So we have different things that we can do. Sometimes, and we love it when it's a combo cream and it's easy and it's dosed according to the labs, of course. But then sometimes people need a little more, a little less. So yeah, so we have lots of different formulas. So absolutely. Okay, so I'm going to get into the saliva testing. So, and I was saying a minute ago, back in the day when I first started doing all of this, it was very interesting because in that world, everyone was doing saliva testing because saliva testing actually tells you what's in the tissues. And so blood testing really wasn't that helpful because everybody was just doing birth control pills, right? And they were doing such high doses of synthetic hormones, and they really didn't even know how to treat postmenopausal women other than with just synthetic estrogen, that it was in perimenopause, it was actually suppressing their estrogen production. So blood tests weren't even helpful back then if you had a woman on high dose synthetic, any kind of hormone. So when you're using physiological protective levels of bioidentical hormones, you want them to be balanced perfectly in your system, right? And you want them optimal. You want them where they need to be, not higher than they need to be and not lower than they need to be. So those are part of my protocols too, is that optimization of being not only feeling good, but protecting your bones and the rest of your body. Okay, so when you fill this out, basically there's a little tube. And so you fill this tube with saliva. You do it first thing in the morning. You can rinse your mouth and then just fill this tube with saliva. And then you send it in, and it's free shipping to the lab, and then it's free shipping to you, and then free shipping to the lab. Best kind of doc to see for hormonal issues. I think the best kind of doctor to see for hormonal issues is a female that's had hormonal issues, honestly. And I am like, I love my fiance. I have a 20-year-old son. I am all about, masculine and feminine and having their, their place. But as far as specialty goes, you really want to find someone who has studied this. And the reason I say you want to find some female who's had hormone issues is because she had to get out of the box. So if you want a physician or a medical doctor like me, then you want somebody who specializes in this, because you would not go to a heart doctor for brain surgery, right? I mean, just wouldn't. And they don't teach this stuff in med school. I promise you. I did a residency program with, I think there were 15 of us in my residency program, and they were from all over the US. And we trained all the same way and with all the, same material, and none of this was in there. It was, a lot of options. Yeah. And it felt like, women were just, they called them WWs, like menopausal women. I'm like in my 30s at this time, but like WW was the term for whiny women, because no doctor wanted to deal with all that. And I have lots of doctors in town that are primary care doctors. I'm family medicine as well, but primary care doctors who actually send their people to me just for their hormones because they don't know what to do with it. And when you're seeing 40 to 60 patients a day, and it's just you get one diagnosis and a pill, it's like one size does not fit all when it comes to women and our hormones. So I think that's, really important that you work with someone who understands. So if you can't find somebody near you, absolutely go to Hormone Bliss and order you a test kit, and we will work with you and we will get you balanced. And so we want you to keep your primary cares, your family medicine docs, whatever you have, but work with us because that's what we do. And that's what we test and we dose. So that's what we do. It's wonderful. Okay, so that's the kit. So when you send it in, then we get the results, and it takes probably about 2 to 3 days to get the test kit to you. And then it takes, once you send it into the lab, it probably takes 5 to 7 days. And so within a couple weeks, we can have these test results. Why do we use saliva testing? Okay, I'm going to go into that. So how does it work? Well, hormones exist in two forms in your body. They are in what's called bound and free. So bound is what's tied up, and I think of, like, I used to say taxis, but nowadays we say Uber. But bound is what is not available to your tissues. It's bound up in a carrier protein like an Uber or a taxi in your bloodstream. And that's great. You can measure that all day long in the blood levels, but you're not going to see what's actually available to your tissues. So saliva testing measures the free, active, and available, actively influences your body function. So that's what we're measuring when we measure in the saliva testing. So how does it work? Of course, me, I'm the nerd, and I'm like, how does it work? How does it work? So we take the little tube. I think you saw the tube a minute ago. We take the tube and we collect it, and then we send it into the lab. And, a couple things about that is that it's easy, super easy for us to do this in mass. So we can help a lot of people. Saliva is very stable. I have a lot of people say, because we have really cold right now with the freezing temperatures, and it's like, if it freezes, is it going to be okay? Yes, it's going to be okay. If it's out in 110 in Arizona degree weather, yes, absolutely, it's going to be fine. Saliva is very stable. Blood is not. If I draw labs and our lab person can't pick it up that day or whatever, it's like after they've come and picked up, like, we can do it the next day, but more than like 2 days, blood is no good because blood is very volatile. Saliva is not. It's very stable and it's not painful. So that's a good thing. Not like a stick. Okay. So the lab takes the sample and separates out the unwanted stuff. Ew. So, like any food particles or any other proteins or anything else that are found in the blood, you can use your imagination, but ew, that's just kind of yucky to me, right? I would not want to be the person doing this job. Actually, when I did my immunology rotations, and we did infectious disease, and so in the lab, we would have to get the poop and like literally separate it out and look at it under the microscope and stuff. It was the worst job ever. So I've actually been there and done yucky stuff, but so extra protein or food in there or whatever else. Then they break it down with a tool, and it's like taking apart a Lego set. So it's a special kind of microscope slash tool. Can't even talk, good grief. And then they measure the hormones with a light laser with electric charges. And I know it sounds like magic fairy pixie dust because it's like, it's just a thing. But it's also called ELISA, ELISA, or enzyme linked immunosorbent assay. And it acts like a magnet, like a mood ring. And so it basically changes colors when it attaches onto the magnet. And that's how they're able to see all the different levels and measure how much hormone is in the tissue. What's the name of the hormone test kit? This one is, we have many different test kits that we can do. This is the trio. It's 3 different hormones. So it's estrogen, progesterone, and testosterone. And the name of it is our Hormone Bliss test kit. And so you just go to hormonebliss.com, or you can go to my link in bio, and all the links are there to order a test kit. And they are only a little over $100. And with our Valentine's special, and it's also our TikTok special. So if you do TikTok 20, you get $20 off. But normally it's $129, which was our sort of meeting ground where because it's normally $299, so we're trying to make it more affordable, but that's our price we've kind of settled into. We are actually getting better pricing because we are selling so many kits, which is, thank you, Jesus, I love it. But so we are hoping to actually very soon be able to even bring the price of the kits down even more. But right now, with the TikTok special, it's $109, so it's a little over $100. Thank you, Connie. I'm so glad you are doing well with it. I love it. I love it. That makes my heart so happy. And my patients, when they're in the office and they're like, it's changed my life. It's like, I know I'm here. I know I'm on the planet. So yay to go. I love it. Okay. So we've got how the test works. Good. Okay. Now I have to get up. I'm going to move this because I got some really cool stuff in the next board. We are going to actually do some patients. Yay, Connie. I'm so glad you feel better. Yay, yay. Okay. Those of you who don't know me, I've had a head cold this past week. My immune system got down a little bit, so I don't know what was going on. I usually do really well with my vitamin D and all the things, but I'm like, I'm kind of yucky. So excuse my frog in my throat. Try not to do that too much. Okay, so this is patient number 1. This is fun. I love it. Okay, patient number 1. So I kind of drew this out, but this is what it looks like. And so I had to do my fun little drawings here so you can kind of see this so we can make sure you can see it. Okay, there we go. Is that good? Okay, move a little closer too. Okay, awesome. I try not to let it hit my head like I normally do. Okay, so this person, let's call her Wendy. Just picking a name. She's a 61-year-old female, and the last menstrual cycle she had was January 3rd. So she's very new on the scene with menopause. So I'm so glad we found her. This is awesome. When we looked at what she was on, though, prior, she was actually on some bioidentical hormones, but she said that she wasn't feeling very good, so she found us. Okay, so she actually came on a troche of estradiol under the tongue and 200 milligrams of oral progesterone and 2 milligrams of testosterone for under the tongue. And you'll see here why that wasn't very optimal for her and what we could do better, right? Okay. So these values are based on what we would call postmenopausal values, which are 0. But these values are also based on what this world, when we're more in functional medicine world, would expect to see. So they don't expect it to be exactly 0. So it's a little bit different baseline than what blood testing is that just a commercial doctor who's checking your thyroid or whatever would do. And again, I am a medical doctor. I'm just saying if they're just like checking an estrogen level or whatever, it's very different when you're checking these tissue levels. Okay. So this person, here's her estradiol. And it was 0.9, which is way down here. So this is the whole range. I know you can't see that very good. Let's see if I can make that a little more visible. So it was 0.9, which is right here. And the range is 0.5 to 1.7. So this was hardly cutting it, this troche under her tongue. And a lot of times, and we do use troches in our office. I mean, I'm not saying, I love troches, they're great. But a lot of times what's happening is some of that that's supposed to dissolve under the tongue actually gets swallowed. Now it's going through the liver for its metabolism. Now you're getting a little bit of unexpected behavior because your liver converts the estrogen, right? So it's not 0, it's not really low, but if your range is 0.5 to 1.7, at 0.9, it's on the really low end of the spectrum there, okay? Her progesterone was 8, and the range is 12 to 100. So that was very low. If the range is 12 to 100, she's at 8. That was very low there. Okay, the ratio of progesterone to estrogen, and I love ratios because when you look at how much progesterone to estrogen, it's so cool because you can see something called estrogen dominance. And when someone has too much estrogen, it makes you feel like you're in PMS all the time. And I see this quite a bit on women who basically have been just given an estrogen patch because they don't have a uterus and they're told they don't need progesterone, yet estrogen dominant, yes, or anything, it's a thing, right? So if you have too much estrogen and not enough progesterone, you are literally going to feel like you're in PMS all the time because that's what happens. That's when your estrogen peaks the most biologically is right before ovulation. So I see it too, even in my practice. I'll see women who are postmenopausal and they're getting a little bit of estrogen because they come in on an estrogen pill or something like that, and they're like, I'm not having hot flashes, but I'm absolutely miserable. So estrogen dominance, even though you can get your doctor to give you a little bit of HRT in whatever form, they still don't feel good. It's horrible just got on progesterone and testosterone. Yeah. So it's a game changer when you can get on some progesterone to balance out that estrogen for sure. Okay, so this lady's testosterone, even though she's taking some troches under the tongue for testosterone, the range is 16 to 55. So at 13, she was very, very low. Okay, so let's talk about what we got going on with her. And so one of the things that is on your report when you do this are these graphs. Okay, and these were her little dots here. So I kind of tried to recreate this. So on estradiol, the range is 0 to 100, right? Remember how I always say 50 at menopause is where everything starts to drop. 50 at menopause, this is where everything starts to drop off, right? This is ovarian failure. I always say hysterectomy is just, or menopause is just a year without periods. Ovarian failure, 100% of us will experience it, whether we have our ovaries removed or whether they just dry up and they are done. So this is that crash line that happens. Okay, and this is estrogen or estradiol. This is age in years up to 100, and this is picograms per deciliter. And so this is 0 to 3. And so where this lady fell, she was right here. So I just said when I showed you that other picture a minute ago, that her estrogen was not quite 0. She was getting a little bit of estrogen through her troche, but she's still pretty low. Okay. And after menopause, you could expect to be low because this is premenopausal or perimenopausal, but we don't want to be that low. I mean, we want to be closer to here, right? And then this is the progesterone. So this is time in years, right? Here's 50, where we usually go through menopause. And this is picograms per deciliter. And then we've got 20 to 200 here. And this is where she fell for her progesterone. Okay, and then this is testosterone. Sorry, I didn't put it on there. And this is the same unit of measurement up to age 100. And it's kind of interesting to see that women actually keep more testosterone because women actually make more testosterone than estrogen. Apples to apples. Men make more testosterone, but it's kind of crazy that we always keep a little baseline there. Estradiol 0.5, progesterone. Oh, Tacoma, I'm so sorry, but I'm so glad that we're going to help. Okay, so symptom categories. So this patient had 50% of her symptoms that she reported were estrogen and progesterone deficiency. That makes sense. So here's her symptom checklist. I can't even talk tonight. Good grief. I guess my sore throat's starting to get to me. I'm going to have a little drink of water real quick. I'm sorry. Okay, thanks for your patience. Okay. So the biggest symptoms that she reported of all those like bazillion symptoms were, they're like on a graph here. See, on a graph here, and you can see the longest ones over here. And so I just picked out the main ones. So her libido was low. She had brain fog, hair loss, hearing loss, heart palpitations, hot flashes, incontinence, and she felt irritable. So when they actually evaluated her symptoms, she had about 50% of the symptoms show that she was estrogen and progesterone deficient, which is what we saw here. And then she had some symptoms of estrogen dominance because she had a little bit of estrogen, but like 0 progesterone. So she was still in that estrogen dominant state. She had low androgens, of course, the testosterone. Here's the level. She was like down here. But she had some symptoms of high androgens. So how can you have symptoms of low and symptoms of high? Because there's so much overlap. Estrogen can convert into androgens or testosterone. And so some days you get a little of this, some days you get a little of that. And so it can be all over the place, which is why I love saliva testing, because it's a measurement in the tissues that's a steady state. It's not just fluctuating blood levels. So the goal is when we get you on bioidentical hormones is to balance all that out so your body isn't like constantly like, oh, well, let's pull some androgens out of the liver and convert those to estrone or a problematic estrogen that could cause um, all sorts of inflammation in your body, amongst many things. So we want to get that's why it's got such a protective effect for cancer and for all sorts of inflammatory things, because everything in your body that they call aging is inflammation. So they call it inflammaging. So anything that you can do to reduce your inflammation, and progesterone is one of the main hormones that decrease inflammation. It has such a calming effect because it balances out estrogen. And estrogens, there's more than one estrogen, but estrogens are very active. That's what keeps you young. That's what keeps your skin young. I'm 55, I'm like, I feel like that's my estrogen is what gives me my vitality, right? And progesterone does the balancing of the inflammation. So too much estrogen going a little bit crazy, it can overdo things, right? Too much of a good thing. And so progesterone's just kind of the calms it down and kind of pulls it back. Um, Sent my sample on Friday. I was wondering consult on Friday is too soon. So last Friday, I would just say call our number tomorrow and talk to somebody, or make sure you should have gotten an email, but we'll definitely follow up on that because I know you're anxious. It's gonna be awesome. I love it. Okay, so yeah, in a given moment, because of all this overlap, and there are so many symptoms, that some of these can feel like, and you can have thyroid interplaying too, but usually when you fix the estrogen, progesterone, DHEA, testosterone, all those things, vitamin D, because we even have vitamin D in our creams, which is wonderful, and that's regular. It's a hormone, so like we put vitamin D in it because it's a hormone too, right? So it helps regulate things there. But sometimes you can have symptoms like she has 15% symptoms that are low cortisol, and 30% of her symptoms go along with high cortisol. And 32% of her symptoms go along with low metabolism, and 22% of the symptoms go with metabolic syndrome. So all of these estrogens, insulin, all that interplays. So that's how we're getting those symptoms like gaining weight around the middle, all those kinds of things. So, okay. So in summary, we know that her estradiol was low, normal, very low though. And we know her progesterone was very low. And we know that her testosterone was very low. And so what I would say from this is that she was getting insufficient dosing with her hormone troches. And so going with a topical bioidentical cream could be a much better option for her. And then we can actually do saliva testing and see what's in the tissues and get a better effect for her. So the reason that those troches under her tongue, or the oral pills, the progesterone pills that she was taking, might not have been working is that it could have been insufficient dosing and she might have needed more. It could be that she has a rapid metabolism, or it could be that her GI tract is not absorbing nutrients well. And that's very common to get something called leaky gut and to not be absorbing as well, because we lose our stomach acid and we lose our estrogen. So it's kind of a vicious cycle. So a lot of components there. Okay. So far, so good. I love you, how you hold the cream. It's like precious little baby. I know it's a precious little baby. I love my cream. We cannot live without our creams. Okay, so good. You ready to do another patient? This is fun. Okay. Okay. So I didn't redraw a whole bunch of boards, just for time's sake. The consult is included in the price of the kit, so all that's just $109. We are kind of working on another platform where we don't have the consult at first, and then you can kind of just come right into the program. But right now, yeah, we visit with you, and you get to talk with one of the hormone coaches and get to find a plan. So that's included. Yes. Okay. So this lady is, how old is she? 56. So we'll put 56 here. And her last menses is not specified, but at 56, we can assume that it's been probably at least 5 or 6 years. She didn't put that on here. So make sure you put all the information when you do it. Okay. Her estradiol was 3.5. So we probably put that about here. So the range is 0.5 to 1.7. So, or 0.8. I'm sorry. The range is on this is 1.3 to 3.3. Okay. On replacement. Okay, so they actually do break it down. It's been a minute since I've looked at these actual numbers here. They do break it down. So she's 3.5, and we probably need to talk about what her therapy is that she's on. She is on, let's see, topical biased, which is cool. I just bought new markers. I'm super excited. Let's see if this one will work. So she's on topical biased. Hey, my writing is messy. And she's on 0.65. And she's on 100 milligrams of oral progesterone. Boy, that's messy. Sorry about that. And she is on, okay, that's it. It's just some estrogen progesterone. And her progesterone was very low at 26. So the range is 12 to 100 here. So on this graph, she was very low. For her ratio, she was low at 7. And here she was 26. And that range is 12 to 100 there. And then this one was 24. So she's at 24. And still low normal here. Okay, so if we were to put her on here, so her progesterone was same down here. She actually did register up here on her estrogen. She was absorbing her estrogen a little better than the other lady was. And then her testosterone was down here. So it's pretty low as well. And her symptoms were very similar, actually, when I'm looking across there. Almost the same. Very, very similar. Because we're seeing kind of the same things going on, right? The symptom categories. And then under her checklist, the biggest things that she says were mild, moderate, severe, severe on anxious, severe on body temperatures, cold hands and feet. So she could have a little thyroid insufficiency there. Most women do. Fatigue in the morning, fatigue in the evening. So she's pretty tired. Foggy thinking, all of these are severe, irritable, and then some of these are more moderate, like low libido. So very similar picture. And when I see women in the clinic, it's like you kind of get used to, this is the picture. This is the picture. I mean, it's very different when you're perimenopause, which it's like all over the place. I mean, it's very unpredictable. Or when you're estrogen dominant when you're younger, or with fertility issues. But this is pretty much the picture we see postmenopausal. So for this age, and even being on treatment, she's still got all these symptoms. So clearly something isn't right. So even if you're seeing somebody and you feel like it's not right and you still need some help, let us help you. That's my passion. Let us get it right. Very high androgens, and I'm 40. Yeah, so if you have a high androgens, that's usually an ovarian dysfunction. And a lot of times we'll call it PCOS. I don't know all your other numbers, but having a higher androgen in a blood level. And 40 is not real high for a blood level. I mean, I've seen people with PCOS, also called progesterone deficiency, with testosterone in the 70s to 90s. So, but if you are having the hair growth on the arm or face and acne and things like that, that can be a problem. And the way to treat estrogen dominance is just to give progesterone. It's really simple. So you just give it during the middle part of the cycle, and it's a game changer. Okay, so the lab comments on this lady were that she did need optimization on her estrogen. Her progesterone was low, so she needs optimization with that. And testosterone is low normal, so she, and she was reporting some symptoms with that. So, okay. One more. This is fun. I love this. This is what I do all day. I love it. Okay, so let's see. This lady is, I'm sure I didn't do that same one again. Oh, I did do that one. Okay. This lady is 65. I get this all the time. Am I too old for hormones? Clearly not. Okay. And her last menses, she didn't specify either. Okay. So this is a sad one, and this is classic for what I see, because about 5 to 10 years out from menopause, when you literally flatline, because here's like hormones, here's time to 100, which you're seeing in those graphs on the other page. But our hormones literally do this, and then about the age of 50, we literally flatline until the grave. People always say, how long are you going to take your hormones? And I'm like, until we can regrow ovaries, because our ovaries are done. We have all the eggs we're ever going to have as baby girls. And once those eggs are, that basket's empty, our ovaries literally dry up. So at 65, if you did an ultrasound on this woman, you probably wouldn't even detect her ovaries. The radiologist would probably read that ultrasound as no ovaries detected. They are done. They're absolutely done. And this is case in point that they are done. I don't know if you can even see this. I'm going to try to, I didn't block her name off, so I'm going to block her name. But all of her levels are like 0 over here. So, okay. So this is kind of classic, what I see a lot. I'm sorry, this is getting messy now. In menopause, that estradiol, okay, and she's not on any therapy, but she is taking some vitamin D, and she was on prednisone for a couple weeks ago. So she might have had a cold or something like that, but she's not on therapy. So she is off the charts low on everything. So she's 0.5. And then they even put the little L there. I don't know if you can even see the little L, but it's like they actually put low. And then less than 0.5. They actually put less than, greater than. Yeah, less than. I always get that confused. Less than 0.5. So she is just off the charts low on everything. And then her testosterone wasn't bad. It was 30. So she's actually making some testosterone. And women do make more testosterone than estrogen, and especially after menopause, you'll actually see, but sometimes I'll see testosterone like 2, but she actually did have a little bit. So these were all super, super low. So if we were to chart her, actually know this name, and she's doing wonderful. I'm so excited. Okay, it's probably gonna hit me in the head in a minute. Okay, so her estradiol was, she's 65. It was down here, super low. Her progesterone was down here, super low. And her testosterone wasn't horrible low. It was like right here, so she wasn't too bad. Okay. And under her symptoms, like she was like super high. I mean, we got like 58% estrogen dominance, but it's hard to tell because she's so low on everything there. Her biggest symptoms were aches and pains. I see that very commonly when all of your hormones are this low, because you need estrogen to lubricate your joints. You need estrogen to lubricate your skin. You need estrogen to keep your bones pliable so they don't shatter because they're so dry and they're just like crumbly. So we need estrogen for all those things. And so to have aches and pains, you need to have lubrication in your joint. And you also need progesterone for inflammation. And then there's also the balance between estrogen and cortisol. And cortisol is your body's natural anti-inflammatory. So if you don't have enough cortisol to calm everything down, you're going to have aches and pains. And frozen shoulder is a really big one. And people don't usually even know that frozen shoulder is a thing. So I'm always like, there's frozen shoulder on the list. Because it's just one of the things you don't think about. All anybody thinks about is hot flashes, right? So, okay. And so she said allergies. Allergies are a big thing because you need progesterone to calm the inflammation down, and allergies are just inflammation. Um, Chemical sensitivities. That's very common. I mean, she's 65. She hasn't had hormones for probably 15 years. And you just get where you can't even hardly drink a glass of wine because your liver's not processing the way it used to. Fatigue in the morning is her biggest thing. She does have some evening fatigue, but that's on the moderate side. um, she's losing hair. It's very common because your hair just starts thinning around the age of 40. And then if you haven't had any estrogen to feed your hair follicles, if you want to go back and watch one of my other videos, I have most all my lives reposted now. I think I'm caught up, but I did one on hair the other night that was good. Not showing symptoms. Okay, Jam, I'm not sure. Not showing symptoms. You might have to elaborate on that question. Okay, headaches. So that's a big thing because you need progesterone as an anti-inflammatory for inflammation that can even happen that causes headaches. Um, Irritable, decreased libido, foggy thinking. I'm having some foggy thinking. I'm having a little trouble, I'll say, getting over this cold. And it's like foggy brain. I feel dyslexic most of the time. It's kind of crazy. I would like to have my voice back. That would be a nice thing. Mood swings, decreased muscle mass. That comes a lot with the testosterone going. Night sweats, neuralgias, numbness in her feet and hands. A little bit of obsessive compulsive disorder. She's got feels rapid aging. You know, that aging where you feel like that just happens overnight. 30, you can yeah, 30, you can balance hormones at any age. Yes, yes, absolutely. Any age. And, like start now. If you're in your 40s, even 35, and you're feeling hormone imbalance, start now because don't wait till you're completely flatlined after 50. Um, Weight gain, that's a big one. I am almost done with my menopause metabolism reset book. I thought I was so close to done. And then I was with my editor the other night and it was just like, oh my gosh. Or actually, it was last night. My days are running together, but I'm closer, much closer. So weight gain is a big thing. Vaginal dryness, water retention, feeling puffy, and cholesterol changes. So I'm feeling tearful. And I would feel tearful too if these were my hormone levels. So um, she's new to us. So yeah, I'm excited for her. That's awesome. Okay, questions, thoughts. This is fun. This is what I do. This is what I do all day. It's so exciting. And then I have my protocol so I can help lots and lots and lots of people. So that's exciting too. Okay, questions? You guys good? Was that fun? We might wrap up a little bit early tonight. So get a test kit, check your saliva levels of your hormones, and go to hormonebliss.com or go to our link in bio and you can find it there. Oh, Connie, yay. Hope that was helpful. And when you get your test kit, you just fill it up with a little saliva and then you put it back in here, free shipping, goes to the lab. We'll get your lab results. We look at all this and we picked you up with some creams. And, like I say, it's not always perfect the first time. But the nice thing is you saw one trend here. People were on troches and they were actually on therapy and it wasn't working. And so that's what breaks my heart is that we're getting better out there at getting people to get help. I mean, there are people doing troches and there's people doing lots of things, but then we have still people who don't feel good. And sometimes I feel like I'm the fixer in my clinic because it's like, even if they could find someone that got them on hormones, they're like, it's not right because they're, just saying that they still have symptoms, but someone's not listening to them and changing. AM or PM for the hormones. Usually, if it's all in a combo cream at bedtime because the progesterone is so good for sleep. My mom used to call her progesterone cream her sleep cream. So yeah, bedtime. Sometimes we'll split it and we'll dose it morning and night. So it just kind of depends on how you're doing with everything. So month to month and 12-month personalized cream programs. Start with your test. Thank you. That's my beautiful little fiance helping out. He likes to make sure that all the riffraff stays off of here because people can be really crazy in TikTok land. But it's been good lately. I think we've kind of found a little tribe here. Normal would be totally depleted at 53. It absolutely, absolutely is. Some people's ovaries just give up the ghost faster than others, and it's not. Would I say normal? It's not uncommon. Is it normal? None of this is normal that we have to go through this. I hate this, but you know, it also helps us find our tribe too because it brings us together. I think that menopause is a time when we need to connect and we need each other and we need to feel like we're not alone. So who knows, maybe in a spiritual way, that's why we do this, right? But I also think that our ancestors did not do it quite this hideously because all this crap in our environment and our food supply and these endocrine disruptors, I don't think our ancestors ever had this much problem. But I do remember like when growing up, there were some people. Um, oh, thank you, Vanessa. I do remember some people that like the moms like lost their minds. And there was a kid in my high school or in school growing up, and his mom went out for milk one day and she never came back. And they had said that she'd gone through the change and that she just lost it. And I'm like, how that affected my friend's life. I mean, he just like it, he kind of went off the rails. I mean, he was never okay. And I'm thinking, oh my gosh, if that poor mom had, I mean, who knows, she might have had psychiatric, all sorts of things, but they said it was menopause. So like we're not crazy. We just need hormones. Oh, Carol, I'm so glad you're here too, Carol. That's awesome. So yeah, so no suffering. We don't need to suffer. Tell your friends. And when you tell your friends, if they don't watch this nerdy girl on TikTok, they're going to say hormones cause cancer. But I know that you guys know different. And I know that it starts with you guys because I'm just one person and we're just one world here in TikTok or Instagram or Facebook or wherever we are. But it starts with you guys and it starts spreading that message. And when you guys are feeling better, it also makes you better to tell people that they can feel better. And the worse they feel, the more prone they are to listen to what you're saying. Because some people, I swear, it's like you just get to the point where you can't take it anymore. And so when you hit that point, then it's like, okay, I don't care. Even if these things did cause cancer, I got to feel better. So, okay, I'm rambling and they're trying to kick me off. I'm going, I promise. Okay, at least don't try to kick me off for saying things anymore that I'm not supposed to. I try to rein it in. I try not to be mean and snarky and talk bad about my colleagues and stuff. But sometimes I just get frustrated. How long before we see weight loss? So I always tell women once we get the hormones balanced, because what happens is when you're younger, quote, AKA, have hormones, you can exercise and eat less and it works. But when your ovarian hormones are dried up, it doesn't work anymore because all of those hormones that regulate your metabolism, including your thyroid, aren't being as compromised, right? Well, all the stuff in the food supply and these endocrine disruptors and stuff, that's kind of all bets are off. But in general, when we're younger, we can eat less and exercise more, calories in, calories out, right? It's an energy exchange. After menopause, when everything is crashed and flatlined, that doesn't work anymore. So when we get the hormone levels restored and optimal, not just a little bit to throw at you, just to let you feel a little better, get rid of a hot flush. When we get them really optimal, it will stop the needle. That's what I always say. It stops the needle on the scale, on the scale. So you will have to make some changes. You will have to do some modest dietary changes, and you have to exercise. But I always say we have to get you feeling better. I call it lead in the butt. When you have no hormones or when they're really imbalanced, you don't feel like exercising. So give yourself a little time, let the hormones regulate out, make some little micro habits, get you some weights and start doing some strength training, something really small. Exercise, good. That's awesome. And I find that people that exercise regular have less problems with menopause too, because you actually make more testosterone whenever you strength train, and testosterone can convert into estrogen. So that's very protective. I had a patient the other day who was a heavy lifter, and I really think that's why she has done better than some people do. But oh my gosh, she just came to me like 2 weeks ago, and she's like doing amazing. She's like, I didn't know I could feel this good, because it's just one of those things, where they just nobody's listening to them and saying stupid things like hormones cause cancer and stuff. I mean, it's just crazy. Um, Someone with lean PCOS work out. Absolutely, everybody should work out. And I know if you have PCOS and you're more androgen dominant, you need to do that all the more, because you need to use those androgens to build muscle. And you're not going to look like the Hulk or anything, but the more testosterone you have, the more it's going to go there. And strength training and interval training, high intensity, actually will help insulin resistance, which is a big part of PCOS as well. So that's good. Consultations. So the consultation is included with the test kit. So it's $109 right now with the Valentine special. So you can put in HEART as the Valentine special, and it takes from 129 to 109. Or you can put in TikTok 20, and it takes $20 off of it too. So free shipping both ways to you and to the lab, and includes that visit with one of our coaches. Okay. I'm tired, and my voice is not going to hold out another minute, and I've gone over my hour anyway. I love you all very much. And if you haven't got a hormone test kit yet, it doesn't hurt. I mean, you don't have to come into our program, you don't have to get hormones, but just see what your levels are. See if they scare you, see if they're really low, and then make an argument to take care of yourself and feel better. Okay, I'm doing Monday, Wednesdays, and Fridays at 7. So I won't see you tomorrow. Sad face. But I'll see you Wednesday night at 7. So tell your friends, and have a beautiful evening and a wonderful tomorrow. And okay, Wednesday.